Christina Juju from Hiraf, Eunice Awino from CWE Tech, Esther Muhati from PHM, Timo Wafula from Kalin, Team EA, Jack Odwar from Umande Trust, Jacob Ngumi from Machakos Group, Grace Olo from Chane, Christine Yakama from Kakamega CHW, Nico Rago from Haki Jamii, Ravi Ram from PHM, Angela Nguku from White Ribbon Alliance, Dr. Selena Biambo from Kenyatta University, Emma Naliama from FAMSA, Esther Okech from Kefliado, Irene Otieno from NTSA, we have Hope Muli from Hivos, Matilda Mbwea from Help Reporter, and Sam Orlando from Pamoja Trust. If we've not mentioned your organization, I send our apologies, but we recognize your presence in the room. On to you, SJ.
So I want us to do a national anthem for KMPDU, or rather for all the unions worldwide. So it's because this morning, I think it will be more vibrant if we stand and sing together. So I'll start. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Thank you. They say short and sweet. So, first of all, I want to welcome all of you for this particular function today. As KMPDU, being in this room is quite a nostalgia. Many of our initial elections and meetings for the union were all carried in this particular room. This is the room where all our delegates used to meet and choose the leaders. And I will tell you that this month marks 10 years since the inception of KMPDU. So it's quite a memorable moment for us in the union. Basically, we all know what healthcare means. And healthcare is not only having the healthcare professionals, having the doctors, having the nurses, having the clinical officers and the community healthcare workers. But healthcare is the holistic approach to it. Healthcare is all the aspects. You must have the patients to have the healthcare. And therefore, time has come that we need to unite and look for a way to ensure that we get the healthcare that we deserve. In our constitution, it's well enshrined that every Kenyan should have an access to healthcare, should have an acceptable service being provided to them, and the healthcare should be affordable and should be available at every point. But we live in a country where all of us access healthcare in different places, and you know the quality and the way it's being accessed. And many a times, most of us are being given political agendas and manifestos. The politicians come to us and ask us for the votes. They ask and give promises that after a particular period of time, we'll get to see all that we deserve in healthcare and in all other aspects. But you all know as me that the Constitution that has given us a lot of power in democracy, has given us all the rights, is again the Constitution which gave us the devolution. It gave us 47 governments in the different counties. So that has made it now, when you go to every county, you'll find that the healthcare is quite varied. That those counties that have taken healthcare very seriously, that those counties that are not implementing it as it is. And therefore, it is up to the leader that is elected in office to determine how healthcare is in that particular county. Therefore, this particular forum is for us to dictate the healthcare that we all ought to have in every place that we go. And therefore, our votes in the coming election need to check which leader are we going to have. Is it the leader who has fired all the specialists in Laikipia? Is it the leader who has ensured that there's healthcare that is strong and is robust like the one of Nakuru? Or is it the leader that is from my tribe, or is it which governor we are electing, or which president? That's why we are gathered here today, to look that whatever we desire and what we want to have is what actually is dictated down. To ensure that every doctor that graduates from the university do not just have the taxpayers' money that is used in them being trained, but after training they're able to get work and serve the Kenyans. That every community healthcare workers do not become volunteers, Well, we have a government where there's a lot of funds going into corruptions, but you in the communities, you're working as a volunteer. You must be paid for that. That's what we are here today to discuss. And this can't be discussed by only doctors. This can't be discussed only by the civil societies. It cannot be discussed by only leaders in the NGOs. But this is a conversation that we can put together in a people's manifesto, such that everybody and every person identifies with it. I think that's the aspect of our discussion today. And therefore, as a union, we highly acknowledge the inputs from Amnesty and from all other stakeholders that after this deliberation, we start a journey of Afya Nation, a journey that the healthcare of your neighbor, the healthcare of everybody is not just an issue, but it's something that they can get. The access is there for everybody. We have all been given an introduction by our sister Stella. None of us in this room has not been affected by COVID. In one way or the other, we have gone into fundraising and into different ways of ensuring that our loved ones or our relatives get health care. But now we can do it differently if we dictate to the political leaders that what ought to be done is done the right way. Otherwise, welcome.
Thank you very much. Let's appreciate Dr. Davji Taylor again. So in the house today, we are honored to have representation from medical students. If you're a medical student, could you just wave from where you are? Yeah, oh, where, bana? Comrades! Comrade power! All right, thank you very much. We also honored to have representation from community health workers. If you are a community health worker in the house, please wave. Yeah! I'd like, at this moment, to invite the chair of the community health volunteers in Nairobi, Ken Adagala. Yes, Ken. All right.
Good morning, everybody. Good morning once again. Yeah, it's a pleasure to be invited to this forum so that we can together discuss and digest about the People's Health Manifesto. Before I take over and give my opening remarks, I would like kindly for all community health workers in the house, not only wave, kindly stand up. Afya yetu, afya yetu, jukumu letu. Asanteni, can have a seat. And just after they have seated, I have the Nairobi, the 17 sub-county person for Nairobi. Kindly, I know we do not have another time to discuss. Just kindly stand up wherever you are. Nairobi sub-county leaders, 17 sub-county. Yes, this one, as you can see from far, right is Abdi from Langata, the great Langata. We have James from Embakasi West, Ngugi, sorry. Hapo nyuma tuko na Juliana from Embakasi East, tuko na Benson Mwangi from Embakasi Central. Nyuma yake kuna Aisha Hamisi from Kamukunji. Anayemfuata kuna Alice Njeri from Starehe. We have Mose from Westlands. We have, Thomas kidogo. Thomas. So we have Enoch, a representative. We have Nyatuke from Dagoretti South and Kimathi from Dagoretti. We have Roysambu Nanzi Minayo from Roysambu. We have Karanja from the Great Makadara. We have Francis from Kibra. And then we have Benson Omai from Embakasi North. We have Francis from Embakasi South. sorry, Omai for Westlands and from Embakasi North. Thank you. These are the delegation and the representative of the community health workers in 17 sub-county of Nairobi. So we are well represented. First and foremost, I appreciate to take this role as the Nairobi community health workers. For those of us who have been interacted, I'm Ken Adagala, popularly known as Adagala, and the community health workers have been on the forefront. As we all know, it is the level 1 of this issue concerning the health. So Nairobi, we have over 7,320 community health workers who are serving 100 households per each community health workers. So you can do the calculation. Out of 320 community health workers times 100 households, that is the people we reach to in Nairobi. We appreciate the progress that you have made since the establishment of the community health workers. It started way back. It runs over 3 decades right now. But in 2010, it was introduced the issue of the community health strategy. And this one, as we all know, we were all in the dispensation of the Millennium Development Goal. And as we can know, even in the World Health Organization, community health work is a resource. And being a resource, it was one of the development goals that was anchored by that time. And they were adopted. And as we can know, SDG number 3 talks about health and well-being. So right now we are sitting here, we cannot be discussing about health and well-being when the community is not healthy. We must be in a position to understand the level 1, the household is equipped and is also in a position to provide the necessary essential services for the people of Kenya and for themselves. This one is also subdivided into community units, and these community units are the one that makes up 7,320. We have 732 units in Nairobi, and that units comes as a result of the community health strategy that was established in 2009-2010. Most people were trained, some of them are still alive, some of them have left, and that is so unfortunate. Under the Sustainable Development Goal, we are able and looking forward through the establishment of the government priorities like the Vision 2030, as well as the universal health coverage. We shall all strive to make sure that we advance and make sure the issues that have been addressed either in the Vision 2030 and the universal health coverage as attained as per the matters concerning the people's health. In the community health services, we are glad that it was just an amorphous, but through the leadership of these people that have stood here and the organization that have had right from the grassroots, we have been able to come up and to make sure that the government of Kenya recognizes that we have community health workers, even though we are called volunteers. And last year, we launched the Community Health Act, Nairobi County. So this tool, I know it has not yet started to be implemented, but after or just being one of the achievements that I have made, the Nairobi City County Community Health Service Act 2019 is giving a roadmap towards making sure that community health workers are paid, are not only volunteers. And even if we are volunteers, even the United Nations have volunteers, but they are being paid and they are driving big. Even Amnesty has volunteers. Even any other state organs have volunteers, but they are being paid. But when it comes to community health, there's no payment. So the roadmap that you have created, the achievement that you have made through the act will make us as community health workers and the communities that we are serving for benefit from the services that we are providing to this nation. We also have other bills that are being passed, are being implemented or talked about in Parliament and Senate, which are going to nationalize the Community Health Workers Task Force or the Community Health Workers Force. And to this note, we understand, if you are here and you come from different parts of Kenya, just reach out to the community health workers there and let's start organizing so that we can be well articulate the matters of the People's Health Manifesto. We understand we have a role to play, and it is very important that we work together so that we achieve this vision. Apart from the said progress, we also have the issue of the challenges, and the challenges comes in because it is man-made. If what we are advocating for will have to be improved. Then through the act, the challenges will be solved. One of them being no payments, lack of materials for reporting or the reporting tools, as well as no welfare. Most of community health workers have died, and if they die, we contribute, and if we do, there's no any other support that we get. So we need a welfare. We don't have one, but through the act, through the Nairobi Community Health Workers Association, we are now working towards making a welfare, an organized welfare that will unite all of us, form a union that will also advocate for our rights. Lastly but not least, I'll take this opportunity to thank each and everyone who has come to this occasion, understanding very well that as the people of Kenya, the issue of health is part of our constitutional right. Under Article 43 of the Constitution of Kenya, we understand one of the aspects on the social amenities is about health, is about housing, is about affordable education and what have you. So as per we advocate for the issue of health, it is not a favor, it is a right, and being it is a right, we should work towards achieving that goal and make sure as a people we understand and we take care of the same. So to this end, to the community where we come from and to the people that we represent, the People's Health Manifesto will guide and serve as a document that will not only see the people of Kenya going forward in terms of health matters, but also advocating for other issues that we understand as a community is very important. Health is wealth. Asanteni.
Before you sit down, afya yangu? Si umesema jukumu langu, si ulikuwa umesema yako? Oh, afya yako? Afya yangu? Afya letu? Thank you. All right, thank you very much. When a child is born, in every locality in this country, there's a high chance that the first person who gets to know, other than the parents, is the community health worker. They are the people who will also tell you which child is vaccinated, which child is due for vaccination, which child has missed their vaccination schedule. They are the ones who will actually also tell you which child is due to enroll in school and which child has not been attending school. And we appreciate the work that the community health workers do in this country. And it's my prayer that, this health manifesto will strengthen that, will strengthen level 1, provision of healthcare, even as we continue this deliberation. So I'd like to invite our next speaker to give opening remarks. After this point, we're going to have a short presentation, then we'll engage all of us. We'll all probably have a chance to speak and share our views. I'd like to invite the Executive Director, Amnesty International Kenya, to come and give the opening remarks. You want to Santanize?
Thank you very much, Mwalimu James Kimila. Good morning, everybody. I'm going to invite Comrade Florence to come to the front, as we also would like to start with a human rights related anthem. Afya yetu, haki yetu. I'll come to this in a minute. Our bodies, our rights. This one for the feminists and those of you who understand sexual and reproductive health rights and freedom from sexual and gender-based violence, you will know this one. Our bodies, our bodies. Sawa, okay. And just so that I don't miss the trade unionists, solidarity forever. Solidarity forever. Okay, I can see tea is needed. Florence.
Thank you so much. Habari zenu? Comrades power. Comrades power. I want power, I want power. Even if you haven't taken tea, I want power. Comrades power. Comrades power. Our people, united shall never be defeated. Let me hear you. Our people united shall never be defeated. I'm here to conduct the Mapambano song, and I want to invite Kasina and Kola to come and join me. Yes. And I would request we stand, because when we do our Mapambano song, it's a very great song that we really honor. And we don't sing one verse, we sing from first to the last. This is a very, very serious song. And Agala, you are also part of us. Come and join us.
Vincent from Kibra.
Hiyo itakuharibu macho. Let's tuimbe.
Zama zama.
Wametosha.
Viva, comrades, viva.
Viva.
More power to our people, more power.
More power.
Aya, tunaanza wimbo wa mapambano na huwa tunaweka mkono hapa. Kupigwa na kupokonywa maisha hakutatuzuia sisi wananchi kunyakuwa uhuru wetu na haki ya jasho letu na haki ya jasho letu. Tumekataa kupiga magoti mbele ya hawa wauaji. Bila shaka sisi pia ni watu, hali ya utumwa tumeikataa. Hali ya utumwa tumeikataa. Tutanyakuwa mashamba yetu, tupiganie uhuru wetu, tuikomboe elimu yetu, utamaduni na viwanda vyetu. Komboe utamaduni na viwanda vyetu. Sisi hatutaki kudhulumiwa, hatutaki tena mauaji, ili kupe tuliangushe, haki na uhuru zichanue, haki na uhuru zichanue. Uhuru wetu wa Kenya, uhuru wetu wa Kenya, tupiganie elimu yetu wa Kenya, elimu yetu wa Kenya, tuikomboe na afya yetu wa Kenya, na afya yetu wa Kenya, tupiganie katiba yetu wa Kenya, katiba yetu wa Kenya, tutekeleze katiba yetu wa Kenya, katiba yetu wa Kenya, tutekeleze. Ole yo, ole yo. Asanteni sana.
Thank you, comrades. Mwalimu James Kimela and Dr. Stella Bosire, fellow leaders of the various organizations that are here, health workers, health rights defenders, patients, and citizens of this great republic. Allow me to start by just making an observation based on Dr. Davji's comment, which is that if this year is the 10th anniversary of the Kenya Medical Practitioners, Pharmacists and Dentists Union, it is also the 10th anniversary of Amnesty International Kenya. Now that one had not occurred to me before. So I think by the end of this year, we have to have a very big party. So that's what I'm putting on the table there. I hope those people who control the budgets in both our organizations can find the resources to buy us masks and music. Let me turn now to a couple of other points. First of all, solidarity is a verb. It is not a noun. It is a word that is created by acting and speaking together. And in this room here on February the 4th, 10 days away from Valentine's Day, is the kind of love and solidarity and progressiveness that this country needs. So solidarity is what will get us the country that we deserve, not a country in which there are medical catastrophes. Over the last 2 weeks, social media and in our rallies, we have seen politicians speaking about earthquakes, speaking about volcanoes. But the question we have to ask them is, when will they start speaking about medical catastrophes that are taking place in our families? When will they start to address the medical catastrophes that are in our communities, that are left at really the mercy of underpaid, under-resourced community health workers and doctors and nurses? And that is the question that we have to place in front of every political aspirant, every political party, so that as they seek our mandate, because they have to seek our mandate, this is not one of the 6 African coups or countries that are run by military governments. As they seek our mandate, let them make sure that the 4 priorities that we are about to discuss are part of their campaigns and part of their manifestos. Allow me to then welcome you all to what is the launch of a national dialogue on the right to health, the rebuilding of our broken health system. And we need to ask ourselves in this moment, if we have not seen the risk and the danger that comes from a cracked health system with the COVID-19 2-year pandemic, what do we need, people? What do we need, politicians, to make sure that the last concern on everybody's mind is falling sick? So I welcome you. I thank you for coming this morning. I think there are 23 to 25 mass associations and organizations in this space. We have power in this moment, not just those of us who are here, but those of us watching on YouTube and watching the live stream. So my request is, please tweet, please share, and please discuss so that we have a manifesto that we can put before all the thousands of political aspirants, regardless of whether they're running for ward seats, for counties, or for constituencies, or even for the highest office of this country, the president. Thank you very much.
Another clap for all of us. All right, thank you very much. I'd like to invite Diana. Uko chonjo ama? Do you need a moment? All right, Dr. Mercy, please come. Diana is still loading. So we're going to be having a short presentation about the state of our healthcare and also the proposals that we are making on in the proposed health manifesto from Dr. Diana Gishengo and Dr. Mercy Nabwire. Diana, you need to be a doctor at the end of this process. Oh, you're already a doctor.
Just an announcement. We have two presentations that are going to happen, the conversation between Diana and Mercy, and then we're going to move into representatives from the different bodies. So we ask that you please preserve your questions that you would have asked because of efficient utility of our time, and then we are going to delve on them once they're done.
Good morning. I am Diana Gishengo. When people get titles of HSC, CBS, for now I am a HRD, a human rights Diana Gishengo, HRD. It's definitely an honor, and like has been stated by the three speakers who made the opening remarks, it is that time of the year that we must ultimately take power back. Take power back that we gave to people who we are not sure whether they utilized it well. We suffered through COVID, okay? And Dr. Mercy here will tell stories of health workers and what they have to go through in hospitals that are supposed to be resourced by government. So we'll have a mantra, and it will be Afya Nation, and you respond health first. Okay? Afya Nation.
Health first.
Afya Nation.
Health first.
Aya, ikibamba sana tunaingia Afya Nation, health first. Sawa sawa? Okay. And so that when you're invited to that political rally, when you meet that MCA aspirant, that MP aspirant, gubernatorial president, you remind them, Afya Nation.
Health first.
Thank you very much. So we'll go into this, and because you can see we have a doctor, I will go to where I can thrive, and then she will go into the details of medical engineering. Nilisoma, lakini sikusoma miaka 6.
Ulisoma miaka 8.
Billy, you're able to, oh, we are good now? Okay. So we are in the preamble where we, the people of Kenya, is given power by the Constitution, reiterating the right to the highest attainable standard of health, reiterating that the right to the highest standard of health is inalienable in our Constitution of Kenya and international human rights instrument. This right has been severely undermined by structures, policies of state bureaucrats and institutions. We are envisioning the revitalization of health infrastructure that will promote health, prevent disease, and guarantee the provision of equitable, affordable, and high-quality healthcare, thereby improving health status of individuals, families, and communities.
Afya Nation.
Hakuna kulala. Acknowledging that the right to health is a fundamental public good, the majority of Kenyans, including 70% of Kenyans who work in the informal sector, still cannot afford quality and timely healthcare services. These Kenyans have lost their lives. They have been pushed to poverty, noting that this scenario or state is aggravated by action that put profit over people. Further, aware that preventive and community health care form the core of the long-term approach to addressing the health crisis in Kenya. Hence, we demand that government allocate substantive resources in attaining that. We desiring working conditions for health workers, including proper and public sector financed advanced training for specialists in all healthcare working cadres. Cognizant that every person has the right to the highest attainable standard of health, which include healthcare services, and covers mental and reproductive health, recognizing that healthcare is perpetually underfunded in Kenya. We demand, we have these demands that we'll expound on later, and we continue to advocate for public sector-driven universal healthcare, and we honor those who heroically struggle to bring equity and equality in providing healthcare services to all Kenyans, especially during the COVID-19 pandemic, to realize, so that in the long run, we are able to realize community-based planning, budgeting, and monitoring of healthcare. We continue to remember people who lost loved ones due to the poor state of health or sank deeper into poverty due to the unmanageable cost of healthcare. And based on this particular background, we are about to propose to you what we have gathered from views of experts, patients, and Kenyan as the People's Health Manifesto. Afya Nation?
Health first.
Afya Nation?
Health first.
Aya. So we have identified 4 key areas, very, very broad areas that we would like you to remember. And if there is somebody who is creative enough to give us a rhyme or something that can sharpen this, so that everywhere people go, they are able to remind all the aspiring political class that these are things that count in this country if we are to repair and rebuild a healthy nation. First, we need to invest in community and public health. Secondly, we need to ensure that each sorry, nimeruka kidogo. Afya Nation?
Health first.
Afya Nation?
Health first.
Aya. This is the first one. Promote health through prevention. Sawa sawa. Do we want to go to hospitals? Or we want to be healthy?
We want to be healthy.
Community health workers and volunteers, watu wende hospitali ama wakuwe na afya nyumbani? Okay, so to do that, kwanza, we need to invest in community and public health. Level 1 hospitals. Okay? We need to ensure that the government is committed to the fact that every household has a balanced diet. Every household has access to clean water. Every household has access to sanitation, a toilet or a pit latrine. Okay? When COVID came, we washed our hands, and they are called diarrhea diseases. Zikapungua hizo. Daktari yako hapa. Then, secondly, the chair of the health workers informed us that currently in Nairobi, every health worker, community health volunteer, covers 100 households. That is 1 too many. Now we are saying tukate hiyo nusu kwanza, so that every community, hatuwaiti volunteer, ni wafanyikazi. Sindio? Na walipwe. Every community health volunteer now covers 50 households. We are also proposing that we introduce, the people want comprehensive health education. Okay? We need to be educated on the basics of health. Health students, hatuna ubaya, hatutasoma medicine, tunasoma health. Okay? So that people are able to cater for their mental health needs, sexual and reproductive health needs, and so on. And finally, ensure access to water and clean sanitation for all across the country. Afya Nation? Afya Nation? Okay.
Afya Nation. Afya Nation. Why are we not? Mbona tuipatie nguvu? Afya Nation. Thank you very much. I think everyone else introduced me, so I'll just move on to present the other parts of what we propose as our demands to the political class as we move into this electioneering period. We need to remember that we are the ones that give them the mandate. Therefore, we have to claim what is constitutionally, rightfully ours. Healthcare is rightfully ours. Quality healthcare is rightfully ours. So we must demand for it. It's no longer a privilege. It's no longer a favor that when you go to a health facility, you get served. It is your right. And that is what we must, demand. And that's why we are here today. So I think Diana mentioned that we collected views. At this point, I might just say we collected views from 11 counties across the country, from healthcare workers across the country. We had very many sessions with community health volunteers. The CHVs in the house, you remember? Si tumekutana, tukazungumza hii maneno, si ndio? And now we have put it on paper and we continue to advocate and push for these things. So secondly, as we make this demand, we demand a public sector-driven universal health care. So we demand that the government that will come into power must guarantee universal health care. So how do they go about doing this? That 15% of the national budget will be dedicated to healthcare. Remember, Kenya signed the Abuja Declaration, and they're yet to get there. We are still at 6%, a 9% gap. We are demanding that this gap be bridged and 15% of the national budget be dedicated to health. And 50% of the counties' budget needs to go into healthcare because we recognize that health is a devolved function, and level 1 to level 5 healthcare facilities are the responsibilities of county government, and therefore a lot of budgetary allocation needs to go to that. Then we must ensure that the government of the day must ensure that 100% enrollment, every single Kenyan, irrespective of whether they can afford or they cannot afford, they should be enrolled into NHIF. And the funds from NHIF, at least 85%, must be spent in our public health facilities. And my SG will say that more than 85% of those funds should go to public health facilities so that we are strengthening our public health facilities so that when you go there, you don't miss the services that you need. And then lastly, not lastly, but we need to expand the resourcing of NHIF so that it's a hybrid system. There's tax and then there's contribution from individuals so that we sustain this fund and it's able to provide coverage to every Kenyan. And lastly, every Kenyan should have access to the entire range of primary health care services at all our public facilities at no cost, so that we are not seeing Kenyans spending out of pocket what they should be spending on food and other things. They're also spending it to buy medicines and to get care, especially primary health care services. So we are demanding that this takes place and the primary health facilities are strengthened and Kenyans access care at no cost. Then we also are making the demand that the government of the day, or the government that will come into power, must expand and strengthen public health care facilities. The government of Kenya has a standards and norms, a document that they worked on with experts. It's out there in the public, however, this has never been implemented. That has tiered healthcare into different levels based on our population sizes and has given functions to these different levels of healthcare and giving the very minimal requirements that these facilities need in order to be operational. And so even the demands that we make on this document and we make today, these are just minimal. They are not optimal. They are not meeting the WHO requirements, but they are minimal to make these facilities functional. So we demand that we get 7 additional teaching and referral hospitals. These are level 6 hospitals across the country so that each hospital is able to serve 5 million people. Remember, these are standards that are set by our government, and so we are demanding that they meet these standards. We are demanding that every county should have a fully functional level 5 hospital. And counties such as Kiambu, Kakamega, Nairobi, that have more than 1 million people need to have more than one level 5 facility. Level 5 facilities will ensure that our people don't need to travel very far. They don't need to go to Eldoret. They don't need to travel to Nairobi to get specialized care. They'll be able to get specialized care in the counties in which they reside in. And then we are demanding that for every 100,000 people, there's a level 4 hospital. So this means that at least every sub-county, the 295 sub-counties we have in the country, have a level 4 hospital. Again, this brings healthcare closer to the people and ensures that they get the quality services that they have. And when we talk about these levels, it's not a designation that it is named a level 4 hospital. It becomes a level 5, level 4, level 3 hospital when it has the right number of staff and cadre, and it has the right number of equipment to take care of the patients. And then each ward must have a fully functional facility, so that for every 1,000 people, we are having a health center, a level 3 facility that can be able to offer minimal surgery services, maternity services, and our level 3 hospitals will operate 24 hours. And then we'll make a demand on the human resources because we have representatives, we have representatives of healthcare workers, right from level 1, the community health workers, all the way to level 6. So we will be making demands that, again, these standards are met across the country, and I'll just take us through what our gaps are and what we need to meet. So as you can see, based on the standards that have been set by the Ministry of Health, if we are to staff level 3, level 4, and level 5 hospital, we will need 20,700 medical officers and specialists. Currently, we only have in employment 6,000. So we have a gap of how many? Almost 13,000 doctors that need to be employed, and yet we have unemployed doctors out there who are seeking employment. We need 40,510 clinical officers employed, 163,945 nurses across the country. Right now, we are yet to meet even half of that. And we'll need 12,430 pharmacy staff, 16,370 dental officers. We will need imaging specialists, 6,410 of them. We'll need lab scientists, so the lab technologists, lab technicians, 28,800. And as we go through that number, even mortuary attendants, we need 5,170. We barely have 500 mortuary attendants in the country. So these are gaps. These are needs that must be met if our people are to get the quality or the kind of care that they need in the country or in our health, especially our public health facilities. And so what does this staffing needs, or what then do we expect when this is met? We expect that level 1, we will have community health workers who will be serving 500 households, and this will ensure that the 3 to 4 people in each household get health education, get linked to a health facility, and get treatment for the common ailments that do not require them to visit a health facility. And when we talk about a level 2 facility, this will ensure that if you visit a dispensary, you're able to get tested for whatever it is you're ailing from, and then you're able to get medicines and treatment. And then we move to level 3, as we said, a level 3 must have at least a medical officer, a pharmacist. You realize that when we have this kind of skilled workers at level 3, we reduce the number of referrals to the higher level facilities. We also bring quality healthcare closer to the Kenyans. So at level 3, we know that you can be able to get maternity services, and you're able to get some surgery done before being referred to the higher levels. And at level 4, we are talking about sub-county hospitals that are able to do higher level diagnostics and also handle very complex cases, and you do not need to travel very long distances to get this kind of care. And at level 5, as I said, we will also be having subspecialized care, and all the diagnostics and all the complex cases will be handled at this level. So because I am a trade unionist, afya yetu, haki, afya yetu, afya nation, afya nation. Yes, we must talk about the well-being of health workers, sindio? Because if our health workers are not healthy, if our health workers are not taken care of, they will not then be able to take care of us. So we want the government that will come into place to commit to transferring funds to the county governments on time. This will ensure that we do not have salary delays, and the salary parades we see in our counties will become a thing of the past, sindio? Then this will also ensure that the working conditions are proper, and also our health workers are provided with comprehensive medical insurance and risk benefits. We also demand that all collective bargaining agreements signed with the various trade unions representing healthcare workers are honored and implemented fully, and that the government will not shy from engaging trade unions and representatives of health workers, but will embrace them and even allow us to form a trade union for community health workers, sindio? It is a constitutional right, and so we must move towards that. And lastly, before I welcome Diana to close, we demand that the governments, both county level governments and national governments that will come into power, will assure every Kenyan emergency treatment. So we demand that any institution, any healthcare institution across the country, public, be it private, that will deny a Kenyan emergency treatment, that will deny any Kenyan emergency treatment or diagnostics, be deregistered. And then at least 85% of the funds or the costs incurred by private facilities to provide Kenyans with emergency treatment will be refunded to make sure that they continue being operational, and we demand fully equipped and operational ambulances for every 5,000 Kenyan. Afya Nation. Thank you.
Afya Nation. As I move to the final ask of the People's Manifesto, I hope mmeelewa hizo numbers za madaktari, si ndio? Health center. Roysambu kuna health center ya serikali? Kuna kuanga na daktari, medical doctor. Inafaa kuwe na wangapi? Wawili, mpaka wanaenda shift. Pharmacist, doctor, pharmacist na pharmtechs. So these are things that we can easily monitor, na tunaambiwa kwa constituency ama sub-county, ukihesabu madaktari kwa hospitali wanakuja 16. Inakuwa kuna shift ya asubuhi, ya lunchtime, ya jioni, ya kabla ukulala, ya ukiota. We are covered, okay? And if you want to think, for me to bring this home, I'll give you two stories. One was in Tana River, where there is a level 5 hospital that has no water. And when we engaged community health volunteers there, they told us that there was a man, he was a man, he said he took the wife there. They have a new maternity wing. They were very excited. The wife was well attended and she delivered. But while the husband was there, she noticed another woman was waiting. But because there is only one nurse, the nurse has to finish with one woman, then wait for the other one. In that process, this other woman, her time came and she just delivered while walking. The baby landed head first on the floor, okay, and died. So when we say we need enough health personnel, that is exactly what it means. When my colleagues went to Kilifi, they heard of a story of teenagers who tried to procure an abortion. They went to some quacks, then they were given some medicines. The girl bled. One of the aunties rescued her, took her to hospital to try and get post-abortion care. There were no guidelines, so she couldn't be attended. But one of the doctors was like, let me take a risk. There was no blood for transfusion. This doctor tested, akaona damu yake inaingiana na huyu akaamua wacha nimpe blood transfusion. Directly as I treat. Okay? But even despite that, this girl died. And after that, the boyfriend was so guilty he committed suicide. How many more deaths must happen because we are prioritizing other infrastructure before we prioritize our bodies, our souls, and our well-being? Okay? Afya Nation. Afya Nation. So finally, we are calling on the next leaders to prosecute all Afya-related corruption and recover all our monies that has been stolen. Okay? There has been very many Afya scandals. Afya 1, Afya 2, KEMSA 1, KEMSA 10, COVID millionaires. Every county has a story of how health-related budgets are being vandalized? Zinaibiwa tu, zina embezzled. So first, that they tighten laws and strengthen investigative and prosecutorial action to convict thieves of public money. We want thieves convicted. Okay? We do not want thieves vying for office. Thieves should be convicted. Then ensure recovery of all proceeds of corruption in the health sector. They need to be recovered with interest and damages within 1 year of the new government coming into office across all the 47 counties. And finally, the ODPP, EACC keep saying they have collected a lot of money from proceeds of crime. That money that is recovered, if we are to attain an Afya Nation, then 15% of money recovered from acts of corruption need to be redirected towards strengthening the health sector. Asanteni sana. Afya Nation.
Health first.
Afya Nation.
Health first. Thank you.
We are not doing so well with time. We are 30 minutes behind, so I'm going to request that the representatives of the different institutions I shall be calling on to please take the shortest time possible. We'll pass the mic where you're seated, and we can honor you from your sitting position. Our first speaker, this is a team of members who are part of the Caucus that guided in the development of the manifesto and the demands and the recommendations that we have today. I have Christian Aid Kenya, Abdul Guko will be our first. Abdul, you can come in front because you're the first one. The second person who is going to speak is our representatives from the students. I usually say, I know you guys say that the children eat after the elders, the millennials and the XYZ generation, we've toppled that up, so we speak first. Andrew Were, please prepare to speak, and then we will go to the Kenya National Union of Nurses, and then we'll do Aisha, who will speak for the community CUH. Abdul. Assalamu alaikum.
Alaikum salam. Good morning. Thank you so much to KMPDU, Amnesty, and all stakeholders. It's such a great opportunity for us to have this conversation as stakeholders, and we are at such a critical moment, especially with electioneering and COVID-19. COVID-19 really exposed our health system, which is really weak, but this gave us an opportunity as the public and citizenry in terms of us having a conversation with the government and ensuring that we are able to inform the government that universal health coverage cannot be achieved through private health solutions. Currently, we do have about 24.6 million vaccines in the country, and out of these, almost half has been utilized, compared to the other countries in the developed world, where about more than 65% have already been vaccinated. I think that this calls for a sensitization and discussion, especially with regards to vaccine hesitancy, and the government of Kenya hasn't really helped with regards to its militancy approach in as far as threatening individuals to go for vaccination. Vaccination should be a conversation. We as Christian Aid are collaborating with different partners and stakeholders through a vaccine campaign that will enable various individuals to really discuss on the supply, access, and uptake of safe, effective, and affordable COVID-19 vaccines. We call upon all stakeholders, especially the health stakeholders, to engage collaboratively in financing, planning, implementing, and monitoring health. Let us engage and find public solutions to public problems. Although the COVID-19 pandemic has taken a toll on us, the flip side is that we do have an opportunity for stakeholders to really advocate for a healthier, safe, and fairer future. The Abuja Declaration stated that we committed, as Kenya's government committed to about 15% of its national budget towards health. This hasn't been achieved. Although with devolution there has been some progress towards attaining about 7%, we are still way behind in terms of achieving these. We call upon investment towards the health sector so that we are able to mitigate issues of pandemic, and also focusing on COVID-19 doesn't necessarily mean that we have to leave the other sectors behind. With those few remarks, I really thank you, and I believe that we can and we must seize this moment together. Thank you.
Shukran, Abdul. Drew, as precise as an appendectomy.
Precise as an appendectomy, as she said. Good morning, ladies and gentlemen. Good morning once again. My name is Alan Were. I'm representing College of Health Sciences, the University of Nairobi, as well as all medical schools across the country. We are so much delighted and honored to be representatives in this meeting today. Such an honor we only have but a reason to smile and appreciate the organization of this meeting. First and foremost, we want to thank God for allowing us to have this time all together to gather here under this roof to discuss matters of national importance as regards to the health sector in our nation. And from a student's point of view, we have a few things probably just to make to our concern in a minute, and then that would be it. First, we want to say that it's not a pleasure where we sit as students or young people or upcoming healthcare workers in the country, having a light of everything going on in our country where healthcare is in a mess currently. And I usually marvel and say that it's only in Kenya where the minister who serves in the docket of the cabinet secretary for health was a student of commerce and insurance at the University of Nairobi. Yet we have healthcare workers and we have very senior doctors. Dr. Stella is here, and many other people who can occupy those seats. We kindly ask you to check on that. Number two, we are also intent to note that Juicy, let me say the day before yesterday, there was a new declaration about research, especially on healthcare workers, that any research into medical practice has been sanctioned such that we have to pay premiums as research organizations to do this. And students, we are much engaged in research programs. We have Dr. Ibsen Ongidi here to be. And such kind of sanctions and premiums that are being set on research in the country is but a way to amputate the medical research. And as we all know, the medical sector can thrive not without any research. Number three, I want to appreciate so much KMPDU and KMA specifically those two organizations, they have been pertinent in student activities and in our engagements. The other day we had a raise in the school fees, where currently Module 2 students at the University of Nairobi pay 636,000 per year, and Module 1 fees were also tripled in a very short while. And this is really absurd. As a healthcare nation, we demand and request kindly that as an association and human rights activists, you equally step in and help our young people in these professions. Tomorrow we shall be the leaders of these associations and this nation in particular, personally standing in as the incoming KMPDU SecGen in a few years' time. And I really request us that we all come in support for all healthcare and give priority to everything that concerns us and the policies. Yesterday during the ward rounds, our consultant said that in 10 years' time we shall experience a very massive brain drain, where our health students and pharmacists and dentists are moving to the UK, Australia, and the US to pursue their dreams in those places. Yet we have a country to thrive, we have a people to treat. So once again, in this congregation today, in this meeting, I call upon us to release our antenna of thoughts and all collaborate in unity with our leaders to bring the agendas of healthcare first and the healthcare of our people at the forefront of everything. God bless you. Healthcare nation first.
Shukran. Thank you. See, we can learn a lot of wisdom from our young ones, including give me a job, a proper job that is with a government that is wary of accountability and is ready to be held accountable and transparent in their doings. So we have a representative from the Kenya National Union of Nurses, and then we also have Kuko and then Kudeya. Can we have them in that order? Representative from the nurses?
You can all come up front, please.
Yeah. You don't have to come up front. You can just stand there. Come. And then we'll give you the mask. Yes. Bora wananchi wa kuone.
House, kindly stand up. National Nurses Association of Kenya, nurses in the house. Thank you for representing the rest of the nurses in Kenya. My name is Betty Kasioka, representing National Nurses Association of Kenya and working in Kiambu County. I would just like to stress one point, or should I make them two? Teamwork is what is going to make us succeed in making those in power account for what we have employed them to do. But if we go scattered, I am a doctor, I am a nurse, I am a CHV, I'm this, I want my rights, we shall not go anywhere. Number two, human resource. Very, very important. Around the country, a ward or a level 2 or 3 hospital should have a minimum of 24 nurses. But as we speak, those departments are run by 6 nurses. And what I can say is that what we are practicing is not nursing. It is witchcraft. Because our leaders have refused to employ adequate nurses. And if you look around the country, what they are doing is building hospitals, dispensaries, and health centers without human resource. Why do you think they're building those hospitals? Who can tell me why? Exactly. Tenderpreneurship. For how long will this go on? Whom are they building those hospitals for? Who is going to work there? If we do not have nurses, we do not have clinical officers, doctors in level 3s, whom are they building them for? This has to come to a dead end, and we must demand for quality health care. And if you know you do not have a vote here, before the 4 days are over, ensure that you go get your vote and vote wisely.
Thank you.
Otherwise, it will be a cycle, another 4 years. Thank you very much. God bless you.
Shukran. Kudeya, a representative from Kudeya. If you don't have a representative, may I please call upon Dan Owala, People's Health Movement. Dan. Thank you.
Morning. My name is Dan Owala from the People's Health Movement, a global movement for health, and we stand for grassroots actions. Now, a lot has been said, and as you know, we sit in this form of gathering, tell good stories, make commitments, but as time goes, they become failed dreams like the Alma Ata, like the UHC. Hizo ndoto zimezima. Now what must we do as a people? That is where we need to discuss. We need to make our people angry enough such that when money is looted at KEMSA, we are out in the streets, not just the doctors alone. When people who depend on medication for terminal illnesses are denied access to those medicines because of bureaucracy at the KRA, we stand as a people because there's no country without people. We can't discuss health without people. Semeni, we are the people. Yes, so as a people-centered movement, we believe that a good healthcare system must be measured by its usability, not by its balance sheet, as it has been in this country. So we must stand up and reclaim the primary healthcare goal that was set by the Alma Ata and make it comprehensive. Comprehensive primary health care. That way, we'll set ourselves in a good path. So, PHM usually celebrates World Health Day on 7th of April. Mr. Irungu, Atela, and all stakeholders, let's organize a public rally that day. Let's mobilize people to come to the public rally so that we are not just seen as boardroom activists. If we go out there, our politicians will take us seriously. So with those few remarks, I thank the organizers of this forum. And please, let's keep on educating our people at the ground. The NHIF conversation is ongoing. It has left the people out. A few people are discussing it at a higher level, and then it will be brought to us to consume. Let us make our own proposal, and let us stop what they are doing, because whatever that is being structured there the way it is now, without our input as a people, it is just a continued structure that is being laid to keep looting money from NHIF to public, to private hospitals, and enrich those who are operating those facilities at the expense of the people and the public healthcare system. Thank you very much.
Shukran Dan, shukran Dan. Gibore from Kuko. Kuko. Thank you. We'll have Aisha Han next. And then the Medical Association, KMA, we have a representative in the room. Dr. Ayabe is here, all right. Yeah. Knumlo. Yes. Please go ahead.
Comrade power. Comrade power. Comrade power. I think Wakili had called for tea for you, but I think you're still strong enough. I want to say one thing by appreciating KMPDU and of course Amnesty International for organizing this. It's a good initiative. I can only say one or two things. As a healthcare worker, or rather healthcare practitioner, we see many things that go wrong. Sometimes you wonder how to address it. Last year around in November, I lost my sister-in-law because of the ineptitude, or rather the gaps that do exist in our healthcare system. In the village, one of the village called Tisinye in Migori County, a person who is post-dated being induced. You understand what I mean? Unampatia dawa ya kumpatia nguvu ku, and then you are in a health center where you don't have even an ambulance. You cannot do anything. And then this patient, it is around saa 8, then una change over, unaachia mwingine tena naye anakuja naongeza ingine, dawa ingine. She has internal, anakuwa na, anapasuka ile rupture, si ndio? Ana bleed, wakimwangalia mpaka anakuwa ile ameisha damu na anakufa na shock. Na anaenda na mtoto. So when you go there and you look at this innocent, one person who is a nurse handling more than 8 people at the same time. Unaangalia, siku hiyo walikuwa wamedeliver wengine 7, so she was to be there. So walikuwa na handle the same time. And the nurse who was speaking here will tell you that is very wrong, si ndio? So when we stand here to speak, I think it is good we keep the focus. Let us not lose the focus. The politicians never want to hear anything that create a question for them. I think the lawyers will tell you when you ask question for politicians, they hate you. Because they know that you are creating a gap. And they never want to fill that gap because they will never fill them. They want a platform where they create their own question and answer them. Sasa sisi tunatengeneza question kwamba wanapotaka kuwa marais na viongozi wa makaunti mahali health iko, wanataka kuongea juu ya nini, si ndio? Kwa sababu health, as one of us has talked about Alma Ata Declaration, I hope most of you have looked at it. It was in 1978. And the provision under that declaration, if was to be achieved in this country, we will not be here advocating for what? Afya nation. So for us, when we are here, I need to encourage you that let us speak about it. Let us have more forum. One of us has proposed, let's stage a procession, and we speak to the world. Don't speak to Kenyan because it is bigger when even the world speak about it. I saw somewhere that Mudavadi is going to cause an earthquake in Kenya, and it was outside the country, because he said, he used a very big word. Let us cause that earthquake about health in this country.
Shukran.
And for that, I want to announce that in the same letter, we are organizing for a bigger conference, a health conference, together with the KMPDU and other unions, and we want to invite everyone to attend. We are organizing a big health caucus conference, which is set to be on 16th and 17th March. It will be at, currently still at Safari Park, and we have our website online. You can actually join, and I believe Amnesty have already been contacted about the same. Let us have this forum and say what we want to say about what we want to happen in this country about our people and the health. Thank you very much.
Shukran, asante. Aisha? Thank you. As Aisha is coming, Numlo, the representatives from Numlo. So we save on time. We don't want to keep you, we promise to keep you until 10. We are going to just request for a little indulgence about 10 to 20 minutes. Go ahead, Aisha.
Hamjambo. Thank you for giving me this opportunity. I'll first start by saying community health volunteers in the house, you stand. So we are going to sing our Afya song. Anyone willing to come in front? Julia, come, so that we sing together, and we are also going to sing with the other group. So the song goes like this. I'm not very good in singing, but Julia will help me. So, Julia.
Okay, community health volunteer, you know our national anthem, Afya Yetu. How we can start. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Ndio, ndio. Afya yetu, afya yetu, jukumu letu. Ndio, ndio. Tukiwa na afya vijijini tuna afya. Tukiwa na afya vijijini tuna afya, ndio. Tukiwa na afya vijijini, tukiwa na afya vijijini, tukiwa na afya vijijini tuna afya. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Afya yetu, jukumu letu. Ndio, ndio.
Thank you very much, Julia. Before I speak on behalf of community health volunteers, I'm going to recognize one of the volunteers who was honored by government. So, Beatrice, you are welcome. You just greet people, and then we can move on. Beatrice, you are welcomed. She was honored, and she's going to introduce herself.
Afya yetu, jukumu letu, jukumu letu. Okay, mmesikia ya kwamba I am Beatrice Iminza Mwashi, HSC from Makadara, na vile wamesema hakuna kuongea masaa, si ndio? Langu tu ni moja, ya kwamba mkubwa wetu wa afya hapa amesema wa manasis, teamwork. Sisi kama volunteers, when we are working, we teamwork. But ikifika ni hapa, tuko wapi? Kwa mtandao yenu, tuko wapi? Since wakati wa Professor Anyang' Nyong'o, tulikuwa tunaitwa Nairobi, Home Based Care Alliance Nairobi. Wakati huo tulikuwa tunaitwa Community Health Workers. Wakati tulipeleka hizo documents kwa meza ya Anyang' Nyong'o, ilitolewa hiyo W ikawekwa V. Since that time, katika pipeline yenu, volunteers tunakufa, volunteers tunazikwa, mapanya zinatukulia mochari, hakuna mtu anatujua. Tuko wapi?
Thank you, Beatrice. As you have heard, it has been a very long journey since we started as community health volunteers, and the government only recognizes us when it comes to giving our monthly reports. But after that, we are nothing to them. They don't respect us. They don't care whatever that we can be awarded, either as a stipend or as a gift, or either just something small for whatever work that we have done. So it is just that sad. We have had several bills, and most of these bills, they are not favoring at all. They are just talking about certificate. We have volunteered for a long time. We have those ones that even don't know how to read and write, but they have been giving monthly report. So it is just unfair when you hear a bill is there on the table and it is not recognizing, it is talking of certificates. Where will we get these certificates? And yet we have been volunteering for a long time. We have been saving lives. We are doing great work. So we are here to cry. We have been left alone and nobody cares about us. The journey has been moving, and from out of those bills, there is one bill that was moving, and it was enacted. After being enacted, we moved, and community health volunteers, they were vetted, and we were promised we were going to get a small stipend. It was also launched on 4th of October last year, and we thought things were moving well, but it is unfortunate up to this time as we are talking, nothing is being talked. We even met with Dr. Oluga, and he was not, he said he doesn't know how much we are going to be paid. He talked of being paid, but when we asked about the money, he said he doesn't know how much we can be paid. So it is just that unfortunate to us that we don't know where we are heading. So we are here to cry. We are doing voluntarily work, which is more even than volunteer, that is working. As we are talking, we were vetted, and after being vetted, the files, our files, they are still at the sub-county offices. They have not even moved to City Hall, so we are still just left in suspense. So on behalf of community health volunteers, I'm crying. It is not easy. You have heard, we are the backbone of the community. We are the pillars. We do raw data. They feed the data, and after feeding the data, they get credit and we get zero. So as I speak, I say, just look into our matters so that at least, even if it is something small, it is better than nothing. We struggled for a long time, more than 20 years. Others we started when we were young girls. Now we are grandmothers and we are still struggling. So if they talk of certificates, where will we get the certificates? And we never went to school. We have the knowledge, we are wise, and we can do it better than those ones who have certificates. Thank you.
Thank you, thank you. I think just to politicize what Anisha has just said is to say even the language around volunteerism is very retrogressive, because what it does is that it diminishes the labor that the community health workers give. And so when it comes to budget planning, it's never thought about, because people think, oh, you get a stipend, you're a volunteer, assuming that you have other sources of income. And yet I know more than 80% of you really dedicate your time into doing this work. Dr. Yabe, and then we'll have Dr. Akoto. I want to recognize some of our leaders within the meeting. Dr. Akoto, Dr. Ganatra, Ayabe, Dr. Yabe, Dr. Akoto, Dr. Akoto, Dr.
Thank you. Thank you, ladies and gentlemen, and my senior colleague, Bosire. This morning, I'm very, very excited because of one thing. The young people I've seen here, the students, Mkwavi. Comrades power. Comrades power. You are our future and our strength. And Houghton and team, inviting these young people ensures that this conversation that we are starting lives on. Because some of us, we are exiting the stage, and these are conversations about the generations to come, about the future of our country. And if you look at the current state of health, as Mama has said, you know, those who are contributing the most, starting from community health workers, are the ones ignored or paid the least. Those who do nothing in this country are the ones who are paid the most. True or false? And it's something that all of us, as my sister nurse from Kiambu had said, must unite to fight for this justice. It cannot be that the salary of one person in a parastatal that is sinking, Kenya Airways, salary of one person can pay all community health workers in Nairobi County. Comrades, power. I want you to feel excited and incited, because this journey that has started is not for the for the cowards. And even as we fight for the generations to come, we must fight for our survival today. Comrades, power. Let us stand on our feet, fight on our feet, until what is right is done in this country. Thank you.
Morning, everyone. I think I'm very happy because having sat here and looked at what people are saying and the attendance of this forum, I realize we are headed somewhere as a country. Health now is a privilege, but the Constitution tells us health is a right. And somebody said there is no health without people, isn't it? So I think, and looking at this electioneering period, I'm also happy because even the politicians now are talking about health, Sindio. So I want from this forum, we simplify for them that we tell them that what we need 7 level 6 hospitals in the country. We need a level 1, level 4 hospital in a sub-county. The nurse here said in a level 3 hospital, you need 24 nurses. So everybody, even you can work and say, how many nurses are here? There are 10. They are supposed to be 20, 24. Another thing, there's something in a name. And the CHP sat here said, the problem started when they were named CHPs, isn't it? I think from here, you can't be volunteers. You need to be people who work. You have a name. You're not a volunteer, you'll remain. You are not recognized as a volunteer, isn't it? You are not in the organogram if you are a volunteer, isn't it? So you need to get a proper name, because so that you get recognized and then you get now your work be done. So from here, let's beat this gospel. And you know, the problem with health, anybody is you are health workers here, for example, but you can turn to be a consumer anytime, even from here now, isn't it? So the emergency services we need to talk about. Lastly, let me give you a short story, and you'll appreciate that Kenyans appreciate what we do, but they also look at the gaps. Last week in a small hospital, I think it's a dispensary in Baringo County, a place called Emining. A mother comes in labor. The nurse said the mother has a big baby. She needs to be referred to a sub-county hospital. But the ambulance takes time. Sometimes people have to pay for that ambulance to arrive. There's nothing to test that, for example, a mother with big baby, maybe there's diabetes, isn't it? But they couldn't test because they didn't have facilities. Now this mother progresses into labor very fast, and she delivers with a struggle, a 5.7 kilo baby. For the people who does those, I'm a gynecologist, so 5.7 kilos being delivered in a dispensary. After that, the community came celebrating with the health workers the milestone that they have achieved. But you see, to me, that's not something to celebrate. That's something to cry about, isn't it? But the community appreciates the struggles we go through. It showed a failed health system, because that can be anyone. Any woman can go into labor anywhere, isn't it? So you should be able to get those. And luckily, the measure for quality health care is the availability of maternal health care. So if we cannot, so we need to monitor how we take care of our mothers, and you see, the mothers are the nation, isn't it? So from here, let's take those numbers and use it. Everywhere you go, where you go public participation, all of you are opinion leaders in those public participations, ndio? Politician akikuja unaambia we don't have a level 3 hospital in our ward. That is the bare minimum. You can't tell us. Even for and I think from here, at the national level, Newton, every presidential candidate must sign this manifesto that they are going to implement it.
Yeah.
That should start there. Every governor must say that they are going to implement this health manifesto. And that is where we are going to, so that the citizen will tell them you signed, you haven't implemented. It will be very simple. Thank you.
Thank you, Daktari. I want to also recognize some of our senior colleagues from the region, Dr. Ndonga, Dr. Kumu, Dr. Mayo. Are you in the room? Good. As they are preparing, would want to have a representative from the Cancer Network, a representative from the renal patients, a representative from people who live with disability. We can bring the mic where you are. And yes, we'll have that line first. So Cancer Network, who's representing the Cancer Network? The Renal Network? Cancer Network, Renal Network? All right. We do not have them, so we'll have a few remarks, a minute from our leaders. Meanwhile, Kellen, Nefak, my peeps, I don't know if we have, who we have in the room from Kellen? Timo? Ah, okay, all right. You have a mask, so I can see you very well. And then we have Bunge la Wananchi. Tafadhali naomba mkuje mbele, ndio tuongee sasa tukisonga. Kenya Sex Workers Alliance, nani yako kwa room? Kaswa. Kenya Sex Workers Alliance, Bunge la Wananchi. Hata sex workers ni sawa, but Bunge la Wananchi. Yeah. Keswa, we have a representative from Keswa. A representative from the nutritionists. I'm calling the last lead so that we can be done. A Nutrition Association. Kemwa, do we have Daktari here? Kemwa or a representative from Kemwa? Hivos will be closing for us in terms of the speakers from the civil society. All right.
Bwana Yesu asifiwe sana. Sema asifiwe sana. Ai, Bwana Yesu asifiwe sana. I think Dr. Bosire, sijui alisomea wapi. Amenita sijui Mero or something. It's Maero. Hey, Dr. Maero. So I just felt like probably that is me. And I came down. I'm passionate about two things. Number one is sexual reproductive health and rights. My body. Number two, I'm passionate about community health work. Afya lako? Afya langu? It's true that health indeed really matters. I remember in 1994, I was I think in class 4, some news came to our place that my grandmother had died. And what we were told then was she had delivered, she bled a lot, and she died. Guess what was the diagnosis then? What was the diagnosis then? Ati? Uchawi. alikufa na uchawi. Alienda akazaa, on her way to that place, I think it's probably a health center or something, aliangaliwa vibaya with some auntie of mine mwenye hakuwa anampenda. Akaenda akazaa, she bled a lot and she died. 20 years later, I came to find out that that diagnosis was called what? Wanafunzi, PPH. So my grandmother died of PPH, postpartum hemorrhage, lakini alikuwa amerogwa. So just imagine if that community was empowered. Sindio? If we had community health workers at that level who were trained and empowered, my grandmother probably alikuwa amezeeka, lakini alikuwa anaenda kidogo, but probably angepata some 5 more years or something, sindio? Because she would have been rushed to hospital at least for some emergency. So indeed, health matters. Let us empower our community health matters. Asante mzungu.
Good morning, everyone. My name is Dr. Ganatra, and I represent KMPDU, and I work in Kiambu County. Mine is just to say something very brief. You and I are here because we know healthcare is a right. The reason why we have made it this level is because we know healthcare is a right. How many of the people that we serve actually know that? How many of the people actually come to hospital and are sent back? Tunawatuma nyumbani, tunawaambia hakuna dawa. Wanajua healthcare is a right. Do they know? So what is our role? We have to bring about change from the top level, the mid-level, and individual level. You have to educate the people who come to you for your services. When something is wrong, don't just send them back. Tell them, kuna shida sababu serikali ilikosa kufanya kazi yake. Isn't that true? So what are we going to do from now on? Educate the people who come to us for our services and make sure they realize healthcare is a right. Thank you.
Afya yetu. Kwa majina mimi naitwa Wino Kutieno. Mimi ni mkaaji wa Kibira na nafurahi kuwa na nyinyi. Kwanza nataka nishukuru wale watu wote ambao nimewasumbua na SMS na messages. Na mwingine nasikia hata karibu mzee wake ampige, ikabidi nimekimbia kule sehemu za Eastlands na kumuomba aniwie radhi. Mimi naitwa Wino Kutieno. Poleni sana kwa wale walipata text saa 8 saa 7 za usiku. La pili, nimesimama hapa kama mwakilishi wa vuguvugu ambayo inaitwa Movement for the Urban Poor. Na nyinyi wengi wenu naona nyinyi ni wakilishi wetu ama nyinyi ni members wetu. Manake wengi wenu hamna kitu, sasa mna qualify kuwa members wa Urban Poor. Sindio? Na ningeomba niseme mambo mawili ya kwamba licha ya kwamba katiba hii inaangazia masuala ya afya kama haki za kimsingi za binadamu, lakini afya hii haijatekelezwa na haijapewa heshima jinsi ipasavyo. Na wale watu ambao wanatakana waheshimu masuala ya afya sio ninyi ambao watu ambao mmeketi hapa, lakini watu ambao tumewapatia hatamu ya uongozi. Hatamu ya uongozi inapewa na inawapatiwa wanasiasa, na hatamu ya nchi imepewa nchi kwa jumla ambayo wazungu wanaita the state. The state has a very fundamental obligation in respecting, in protecting, and in fulfilling right to health. Kitu moja nataka kuongelea. Tangu rais aongee mambo ya universal health coverage, hospitali mingi za kibinafsi na hata zile ambao zilikuwa zimeanguka, ukitembea mitaani sasa utaona zimepakwa nini? Rangi. Lakini mle ndani hamna chochote. Mimi ninawaomba ninyi kama watabibu, na mimi pia ninawaomba kama watetezi wa haki za kibinadamu. We must move away from this thing called universal health coverage and go to universal public health coverage. Those private hospitals are benefiting immensely from public reimbursements. Unasikia? It is those public reimbursements that make those institutions survive. It is time to demand for universal public health coverage. Asanteni sana, na nataka nikuwe na jina yenyu kwa database yetu ya movement of the urban poor. Mungu wabariki, Mungu wasaidie.
Good morning, colleagues, gentlemen and ladies. My name is Dr. Okumu Charles, and I want to first of all thank Amnesty International and KMPDU, for which I work for also. Amnesty International has been in the forefront for fighting for healthcare workers' rights, together with KMPDU and all healthcare workers' unions that are represented here. I am happy to note that we have the community healthcare workers here and the volunteers. I want to reiterate two things. Number one, the volunteers, get yourselves a name. That is the only way you are going to be recognized, and the doctors have a story to tell. The doctors at one point in this country were never recognized, but we fought our way to the point that right now doctors in this country have a name, and I want to encourage you, clinical officers in this country have a name, nurses in this country have a name, community healthcare volunteers, you must get yourself a name for you to be recognized in this country.
By force, by fire.
The second thing I want to reiterate is what a colleague mentioned here. We will sit here and speak and chart our paths like we have done before. But at the end of the day, we must ask ourselves, what is it that we must do? All these things that we plan here, if they don't go as we intend them to go, what must we do? I want to leave each and every one of us with that question in their mind. And if we don't have a plan of what we must do, then for sure, 5 years, 10 years from today, we shall meet again in this same ufungamano, speaking the same items without a plan of action. So colleagues, let's know to ourselves what is it that we must do to achieve all these things that have been mentioned in the Alma Ata, Abuja conference, and so on and so forth. UHC, we have seen. I work in Ukambani region, and I have been privileged to see 2 counties miserably fail at the UHC program. We must know what we have to do when we see such failures. Thank you very much.
Hi everyone. Afya Nation. Afya Nation. My name is Dr. Caroline Mwaura. I am a KMPD representative from the Central Region. I present some 5 counties and JQuat University. Let me say I'm very glad to participate in this conversation. I have both been a victim and somewhat a beneficiary. Someone mentioned about how they lost their sister-in-law. Well, I was almost losing my life, and I lost my infant around that time because of those gaps that we are talking about today. In the second instance, my mother happened to be very sick. She had an autoimmune condition, and let me tell you, what helped us was traveling to India. First of all, even getting the diagnostics to diagnose her condition was really hard, and it came at a point where her health was actually getting critical, and going to India exposed me to the kind of healthcare that we need in this nation. Afya Nation. So we went to Apollo Hospital in New Delhi, and I'm telling you that's where health is manufactured. Hallelujah. Yes, enough consultants, enough nurses, enough drugs. We can achieve it as a nation. We can achieve it. Comrades power. we can achieve it. Thank you.
Thank you, Daktari, for sharing. Sometimes we tell these stories, and there's a proverb that says, until the lion speaks, you know, they give their tail. You'll only hear about the hunters, right? And so you get to hear about the lions who are the forefront.
Comrades power. Afya yetu. Afya yetu. Kwa majina naitwa Florence Kanywa. I'm a social justice activist, and I really like pushing things that are not going right way. And especially when matters of health are touched, I can put my life on fire. I want to appreciate Dr. Stella Bosire and Kisia for the work I have seen you do when things were very, very bad concerning health matters. And unless we decide to become activists, all of us, things will never move. The difference between Africa and the other European countries is that European countries, when it comes to matters of advocacy and agitating for the rights, people come out in big numbers. The problem we have in this country is that we activists come out to fight for the rights of everybody, and the people we are fighting for their rights, they call us busybodies. It is really pathetic. I want this narrative to change. And now that we have many health workers who are working in community, we can be able to change this narrative. The other thing I want to say is this. This matter of health we are discussing about here today is right here. How many of you have read the Constitution of Kenya 2010? Inua mkono kama umesoma katiba ya Kenya 2010. We need to call a spade and not a big spoon. We fail to pursue our rights because we don't know. This Constitution, I'm not here because I want to read it, but I want to talk about it because we Kenyans fail ourselves because we don't do the right thing, the right time. The preamble of the Constitution says, all sovereign power belongs to the people of Kenya. Did you get that right? It is right here. That is the article that gives you all the power. The sovereign power does not belong to the president. The sovereign power does not belong to the member of parliament. The sovereign power does not belong to the governor or any elected member of parliament or MCA. It belongs to the people of Kenya. So once you know all the sovereign power belongs to you, you must wake up from your comfort zone and fight for your right, because you are the most powerful person as the Constitution of Kenya. The matters of health that we are talking about today, it is right in Article 43 of the Constitution of Kenya. Hello? Can you get time to go through this document? Because once you know what is contained in this document, the Constitution of Kenya, you'll be a free Kenyan who will be ready to fight for the right. Thank you very much.
Hi, everyone. My name is Catherine Nguge. I'm with Kelin. That's the Kenya Legal and Ethical Issues Network on HIV and AIDS. And we work to promote and protect health-related rights. I'm very excited to be part of this conversation and to especially sit with practitioners for the medical side, which are people that we interact with, but not on a large scale, given that we are lawyers. And one of the things I think which really stood out for me is the fact that when we speak about the manifesto, it's coming from the people. It's about presenting the people's demands when it comes to accessing and enjoying health as a right in Kenya. And another thing that really resonated with me is the fact that we are pushing for comprehensive education when it comes to health issues, especially SRHR, that's sexual reproductive health issues, but also the fact that we want people to be involved and participate actively in determining how they access health as a right, through being involved in participating in allocations, budgetary allocations, and determining financing in healthcare. So I'm very excited to be part of the conversation, to be here with all of you, and looking forward to learning more. Thank you.
Good morning, everybody. Habari za wa Kenya. We, the sovereign people of Kenya. Am I right? Am I right? Okay. We're going to learn another one, yeah? My body, my right, my body. Okay? Tumeshika hiyo. Afya yangu. Afya yako. Oh, great. Well, nitaanza na I'll mix my language because I understand and I've understood what Mama told us. Some of us, as Kenyans, we don't know how to read and write, and some of us may not understand all the English we speak. We use the other national language, which is Swahili, Kiswahili. And I hope at some point, because I saw we had a lot of conversation, we will also include the other language. Do we know which one it is in the Constitution? We were being taught about the Constitution just now. Kuna Kiswahili, lakini kuna ya tatu. Tuko pamoja? Please, maybe in the next meetings and as we go forward, let's also ensure we are inclusive and add that other language so that our colleagues can also be part of this conversation. Nitaongea juu ya ununuzi wa umma. Tunajua ununuzi wa umma ni nini? Do you know? Public procurement or public contracting. We are talking about the scandals. How do the scandals happen? What part of the equation of the cycle of public finance do the scandals happen? Tuanzia kwenye budget kwa sababu tulisikia kuna nini? Budgeting for corruption. And how does the money get out? Through procurement. So it is very important, even as we have these conversations, we look at the finance element, our public finance. Na tuanze kuelewa the different stages of public finance management. So that we are saying, we know what is in the budget, we are influencing the budget. Right now, we discussed the 6% that is being allocated. What is the stage we are in the budget cycle right now? That tunasoma kidogo. I know I have 1 minute and I'm trying to get us to go somewhere. We are in the physical strategy paper. In the counties, inaitwa nini? County physical strategy paper. And there is also the debt management strategy. Hiyo ikipita tarehe 28th. Right now it's being farmed up. 28th of February ikifika, it will be closed. You cannot influence it. You cannot increase that amount that you're asking for to move from 6% to 15%. So let us know at our entry points. This is the time to demand that the ministers for finance, CEC's finance in every county must ensure they increase that health budget. The county physical strategies papers must have a vote line that is higher for health so that we move to 15%. When that is done, we go into the estimates and we have to ensure haitatolewa. We have to ensure we go into the budget in June and it is still there. How we lose money from the health sector and other important sectors is supplementary budgets. People, we have to start tracking supplementary budgets. Kwa sababu mutafanya public participation mzuri sana, we will be consulted, we will have issues, budgets will be passed. Then budgets will be moved. And then we won't notice. At the end of the year, we are saying the nurses, we have said we are changing the language for volunteers are not being paid. So we need to track the key government documents. Then procurement. Kwa sababu pesa ikiwekwa lazima itumike vizuri. The scandals we are seeing are because we are not tracking procurement. So kwa hivyo, kwa serikali we must demand uwazi wa ununuzi wa umma. In English we call it open contracting, where citizens can see from the planning stage to the bidding, to the evaluation of the tenders, to the management of the contracts, and to the termination of contracts, how every stage has been done. They can critique, they can question, you can even advocate for stopping of bids that you're seeing, either there is rigging or there is mismanagement. As early, si tunaongojea pesa ikipotea, tunafanya post-mortem. So in our advocacy, we must demand open contracting so that we move from a post-mortem approach to an approach that is preventive. Munaongea preventive healthcare. We have to prevent the money from being stolen in the first place. Thank you. So that is my request to us. That's the journey I'm hoping we can walk together, and let's all be open. I am learning things in the medical world. I hope you will learn some things in the financial world, and we'll be able to have better healthcare for all and accessible, affordable, acceptable healthcare. Tafadhalini. Thank you very much. My name is Hope Muli. I serve at HIVOS.
Thank you so much. Thank you so much. We have our final speaker, Kemwa. They were not able to join us physically, so we'll have their remarks online. I hope they also adhere to time. We have done so well. It's now 10 a.m. We anticipated to close by 10 a.m., so I would not really require to take more of your time. So, yes, social.
Thank you very much, Stella. I'm standing on the protocols that have been said, and thank you very much for giving Kemwa the opportunity. Kemwa would like to make a statement and joining the rest in demanding for good health for all Kenyans, irrespective of where you are, irrespective of your financial status. But being a women's organization and fighting for women and for led by women, is a women organization led by women doctors, I would like to state that when health of a nation is not good, it is the women who suffer the brunt of that decisions of that bad health more than anybody else. And I would like also to state that leadership is what gives us good health. And therefore, as we embark in this journey, we will need to document real stories like I've heard them. As part of this nation, sometimes we used to have good health, and the people who are going to Asia, to India, Indians used to come to access health services in Kenya. So that story needs to be painted, and therefore we do a trajectory of where has the leadership failed Kenyans and failed women of Kenya. So today I would just like to make that plea that as we embark in this journey, let us document real human stories. Let us be evidence-based as we challenge and do a manifesto, a people's manifesto. We in Kenya, in Kemwa, would like to join you in that journey and let everybody that is taking leadership know that it is not only health we are crying for, but when health fails people, then economy cannot thrive. They cannot have food. They cannot
much, Dr. Masi, and thank you for joining us online. I'd like us to move to the closing remarks, but before we do that, and as I get ready for that, I'd like to invite Lavender Namdiero from Amnesty and Dr. Miskela Bega, the Deputy Secretary General for KMPDU, who will be giving us the final or closing remarks. Once we are done with that, you remember the tea? Remember the tea? The tea will be served at the garden, so you have a beautiful spot out there at the garden where you can engage this conversation further, chat a bit, enjoy your tea. But as we all walk out, I will invite the media team to come to the fore. But that is after the closing remarks. So first, let's begin with the Deputy Secretary General, KMPDU.
Good morning. Thank you very much. So as we close, I want us to close on high remarks and on high note. So when I say viva, comrades, viva, you say viva, okay? Viva, comrades, viva. Viva, Wakenya, viva. We must have energy when we are making demands. Sindio? Yes, I'm Dr. Miskela, the Deputy SG, to Dr. Davji from KMPDU. And as I summarize this, I have to first of all apologize that I came late. I was following online. I had a word round, so I was like, do I come to talk about health as a right here, or do I give the Kenyans their right in the word round first, then I come here? I chose the reality bit of it, yeah? Yeah, so first of all, you know, the president of the urban poor was here saying that Mungu atubariki. No, if God blesses us, we can't be in this union or this association because we won't be any poor. Sindio? Yeah, so anyway. So there's a story about the village baker who used to bake very nice bread. But the only problem is that as he went about marketing his bread and talking about this bread, when time came for his breakfast, he would go to the neighboring shop to buy the bread for himself and his family. And that's where we find ourselves as Kenyans. We have a village baker in the politician, in the leaders in healthcare, making beautiful promises, how their bread is the best. They'll make bread for everybody, UHC bread, you know? But when time comes for breakfast for themselves and their families, they buy bread in the next shop. So that when we complain that this bread is too salty, too sugary, they never know what we are going through because they are buying bread from the next shop. And we are telling the Kenyans today that if the baker cannot listen to us telling them what we want in the bread, we want less yeast, it's giving us bloating, right? We want less salt probably, okay? We are telling them that even the bread they're writing as 1 kg is 800 grams. We must tell them and they have to listen. Or we'll have to start baking our own bread. Sindio? Luckily enough, in August we have a chance to be involved in choosing our next set of bakers. I hope that we won't be putting back the same bakers who have given us bread that bloats us. That analogy is as simple as it is. I don't think it requires any interpretation. Sindio? 2, when you hear colleagues, Gibore, Carol, talking about some of the things that they have undergone or have witnessed as the healthcare fails, those are the few stories of somebody who gets a chance to pick a microphone and talk about it. But it is replaced everywhere in this country. Every village can tell you that they have a death that could have been prevented. True or false? During the COVID times, you have lost almost 6,000 Kenyans, probably more than that. Of course, the numbers will have to be lowered because the shame is too much for the bakers. Yeah? If you look at the deaths, they could have been prevented. I work in Kenyatta as a gynecologist. And the people who we see die, they're mostly referrals. Because for the women, dying from very preventable things that can be picked up early enough. If we could let the community health workers be properly trained, paid, and motivated. Of course, let me digress briefly that, let me digress briefly by saying that when you want to kill a dog, you first give it a bad name. So they have intentionally called them the volunteers for a reason. When the white man came and wanted to colonize us, they told us, we'll have to Christian you, a new name, a Christian name. True or false? That's why we must push back from the name first of all, before we demand for any other right. So, anyway, that's a digression, but we must stop seeing death as what is promised. We live in a country where when somebody dies, even from something that could be prevented, we say God plucked the best from his garden. Sindio? Kwani Mungu ana pluck tu maskini, he does not preach. That we must carry twigs when our people die from preventable causes. When schools fail, we carry twigs and chase the headmaster. When the roads are bad, we carry twigs and plant bananas on the roads. How comes that when our people die, now it is God plucking the best? How comes that we ask that the roads are bad, we'll get better roads paved with gold in heaven? We demand. Let us demand for better healthcare. I want to talk briefly about something that our country lately is crazy about. Privatization of public failures. That is what is killing us. I think that government intentionally has killed the public health system to prop up the private sector. So that when you, and more than ever, if there's a government that puts private interests in healthcare than any other government, is the Uhuru Kenyatta government. Get that? So when they clap to you that, oh, UHC, NHIF will be for everybody, 80% of NHIF goes to private hospital. And in private hospital, it's business. I normally use the analogy that it is not out of the goodness of the butcher that he sells meat. Mtu akifungua hospitali pale, ni pesa anataka. That's why if you are having an emergency, they won't take you in. Usipolipa, they'll detain you. Yet with this privatization, there has risen a new level of private sector. Now when the public fails, you go to the private sector, right? Hoping that you'll get better services. But now we have a new set of poorly run, poor quality private sector. Offering poor healthcare for poor people. Yeah. Right now I have a friend of mine, he's in New York, his wife came over for a funeral, then she got malaria, then she's been going to this funny facilities. She's now in ICU in Kenyatta with cerebral malaria, dying almost. Yeah? Because they went to these funny facilities. So we must shift back the debate on how do the patients leave the public healthcare to the private, and how do we take them back? Because if we don't do that, we are just one major illness away from poverty. Trust me that as a doctor, currently I don't belong to Opioids Association. I'm not an urban poor. But every day as I sleep, my only worry is about my aging parents. We will all die. That's a promise. So I know one day they're going to die. My worry is that what kind of bill will I have to endure in that process to make them live longer or as they die comfortably? That's what I worry about every day about my aging parents. And I'm sure most of you worry about that. Sindio? And we must take that burden away from the Kenyan people. The living must stop worrying about the death and the dying people. And now we have Ruto promising the universal health coverage. Babake is just about the same thing. All they're telling you that they'll be collecting lots and lots of money to bake bread. But they're not telling you that they're going to be making better bread for you. You get that? So you cannot compel us to pay for the insurance funds. That's how it will help us, how it will translate to quality healthcare. Right from the down, where we have community health workers talking about hand washing, talking about anti-helminthic C, kupeana nini, dawa ya minyo. All the way up, you know that if they pick up something, they can take it to level 1 or level 2. You get that? Please, as we go to this election, you either be part of the people on the dinner table eating or part of the menu. Let's engage the politicians. Let's sign our charter. More importantly, please, let's vie. We have healthcare workers. Let's support them. I know Dr. Luga is vying. I know Seth Panyako is vying. And many others are vying. Let's support them. Kwa hali na mali. Viva Wakenya, viva!
Testing. Kimila, I would like to try something different, if that's okay with you. It'll take a second. So, I just want to see who I'll get the loudest response in the group, and you'll walk away with one of these nice t-shirts you've seen some of my colleagues with. Is that okay? The loudest response. Afya Nation. Let me try again. Afya Nation. Did you get the person? Wait, it was rigging. Afya Nation. I think all of them, all of them win.
Can we give all of them?
I think we can.
We can actually give all of them.
I think we can after this, no? Perfect. So dear colleagues and friends, first of all, I'd like to thank KMPDU for your partnership and guidance in this process. Thank you to the Secretary General, Dr. Davji Bimji, Dr. Mercy Nabwire, and Alphonse Were, and other unmentioned KMPDU members for your leadership during this week. I would like to thank all community members across the country who made this process a truly people's-driven process, for making it a people's manifesto. I thank all partners of the civil society for the constructive and collaborative way that you have worked to help flesh out the policy issues linked to the pressing health challenges that we've discussed today. I know today is a culmination of months of hard work for many colleagues and friends who have engaged in long hours of consultations and preparations that have resulted in this smooth and successful discussion of the draft manifesto. We have adopted about 6 key asks linked to affordable, accessible, available and acceptable right to healthcare, and we're committed to finalizing the health manifesto and having it delivered to different political party secretariats in due time. Please let us know if you're interested in healthcare in Kenya. And many of these recommendations require further discussions, obviously, in our country's leadership. The reality is we still have a lot of work to do, and this has been emphasized by all the speakers. But we encourage that we have the tools and the spaces to actually have policy change, and this is one of them. We hope to take the finalized manifesto to every county and empower our people on the ground. The challenges we face are quite profound, and so must be the solutions we design. I urge all, to become a truly Afya nation, we need a generational commitment that outlives budgetary cycles or election cycles. Lastly, the right to health must not become an empty slogan. It must become the experience of every person in Kenya. Thank you very much. You want more t-shirts? Afya Nation? Afya Nation? Afya Nation? Afya Nation? Thank you.
All right, just before you leave, I'd like for us to all upstanding join in our national anthem. Tuliimba the first stanza tukianza. So I'd like for us to, there's a standard that challenges us to take action. Hiyo ni gani? Amkeni. The second stanza. All right, so are we ready? Amkeni ndugu zetu, tufanye sote bidii, nasi tujitoe kwa nguvu, nchi yetu ya Kenya tunayoipenda, tuwe tayari kuilinda. Thank you very much. Asanteni sana. So as I had mentioned earlier, tea is served at the garden. So we'll exit through the exit on my right, and ile ya pale nyuma, we go to the garden. We'll serve our tea. I'd like to request the gentleman and lady at the bench to... All right. Oh, God, kuna announcement.
Okay, so thank you everyone for who's taken their time to be here. If you'd like to be part of the manifesto, if you'd like to take part in the final document, kindly let us know. You can leave your contacts, leave your name there. We'll get in touch through email. We'll also get in touch when we are unveiling the final document that you'll be part of. Thank you.
All right, thank you very much. The media representatives in the house, please, you can use the side door, come to the front. Ladies and gentlemen, please wait for the media briefing. The rest of us, let's proceed outside for the tea and snacks. We'll also get a chance to have t-shirts.